Well, good day. My name is Greg Downing. I am the owner of Funny Healthcare. Today is September the 6th, 2013. We are less than 30 days away from October the 1st, when apparently we can all sign up for health insurance at little or no cost. So today I want to share with you how one can learn before all this comes into play if you will qualify for the subsidies, or how many of your employees will qualify for subsidies. You happen to be an employer looking at this. We'll show you how to do it. Now, we work closely, as you can tell, with all of the high profile people involved in Obamacare. That's Kathleen Sebelius, who's in charge of the Health and Human Services at the United States of America, and who is in charge of this crazy thing. It's hard to get her attention, but we have been trying to do that. So here's the simplest thing to do, and that's just to go right to our website, which is ObamacareMadeEasy.com. And if you go to ObamacareMadeEasy.com, you will see that right here it says individuals and employees learn how to get health insurance at little or no cost. So all you want to do is click on that, and that will take you directly to the page that will explain most of this information. So there are two key components to find out if you qualify. The first one is you do not have access to affordable health care through your employer. There is no group plan available. And if you're married, if your spouse doesn't have access to affordable health care through her employer, then you've passed the first step. The next step is that your household income is between 100% and 400% of the poverty level. Now, if you're like me, I have no idea what that means. We do have a little video. If you were to click on Dale, he can actually explain how the subsidies work, but we're not going to do that today. We're going to go right down here to the chart and get to it very quickly. Now, this is the 2013 Federal Poverty Annual Income Level Guidelines. That's a lot to say, but you can see it. And it's based upon one's household. An individual, single person, poverty level is $11,490 a year, but they can make up to almost $46,000 before they hit 400% of the poverty level, and those folks will qualify for subsidies through Obamacare. Something that I will show you, that let's say there's 4 in your family and your household income, you can make up to $94,200 and still qualify for subsidies through the Affordable Care Act. Now, this is what you need to think about, and this is what's really important and what will change the dynamics for lots of things, and that's how the subsidies work. So the subsidies are based upon your income, and it's capitated on how much you will pay. For instance, if you make 100% of the poverty level, you will only have to pay 2% of your household income towards health insurance cost. And the more you make, it gradually caps out at 9.5%. So you can make, for instance, 150% of the poverty level, and you would only have to pay 4% of your income for health insurance. Now, let's do a real live example of this, and this is the beauty of this page here. It has all the information you need right here. Click on our friend Chevrolet Monte Carlo, and it will take you to a subsidy calculator where you can find out exactly how much you're going to have to pay. This is from the Kaiser Foundation, which is a great resource. They have by far the best information. But this little tool allows you to come down here. I'm not going to read all this, but I'll show you how it works, and you can do this on your own. Right here, what you want to do is everything's going to be based upon your projected income for 2014. So let's say that I'm going to make $29,000 this year. I don't have access to affordable coverage. My employer, which is me, God, he's lousy, doesn't provide health insurance. And I have 3 folks in the family. I have myself and my 2 children, my 2 sons. So the next step over here, 5, is how many adults 21 and over? Well, there'd just be one of me. And then how old am I? Well, I don't really care. I'm 49. Geez, I'm old. Do I use tobacco? Well, not that I'm going to tell you about. And how many children? Well, I've got 2 of them. And how many of them use tobacco? Well, I'm sure if they're like most kids, they try it occasionally, but we're going to put none. And then we're going to hit the magic submit button, and look what happens. We have an actual result. Well, that's good. So what this shows us here, that I'm at 148% of the poverty level, and the estimated cost for the health insurance would be $8,982, and I only have to pay 3.91% of my income, which works out to be $11,135 $1,135 a year, or $96 a month that I have to pay for health insurance. And then the government will pick up the rest and pay that portion to the insurance company. So I'd pay this amount to the insurance company, and the government would pay that amount to the insurance company, and that would cover me. Now, this is all based upon the silver plan. Silver is the magic metallic level, in my opinion. That is the only way to go if you can do that. So everything is based upon the cost of a silver plan. And I would recommend, if there's any way possible, to buy a silver plan. And the reason why is that if you're below 250% of the poverty level, you get an extra bonus, because if you'll go down here to out-of-pocket expenses, your out-of-pocket maximum for the silver plan is reduced to $4,500 because they subsidize that as well. So I'm going to scroll down here a little bit here. So normally the silver plan, the insurance company pays 70% of everything, but they'll subsidize your out-of-pocket costs, so they actually pay 94% of co-pays, deductibles, things like that. So that reduces that tremendously. The Plan C gives you, the silver plan gives you the best bang for your buck. Now, if there's some reason you can't pay the $96 or whatever it is that you're looking at, and your family doesn't really have anything going on, you can also another option is to drop down to the bronze level plan. And in this case, what does it say up here? You can read this stuff, but you could actually get the bronze plan for free, because it's estimated to cost $7,444, which is less than the amount that the government, so they would actually cover all the cost in this particular example. The downside of that, if you're in the bronze plan, then you're going to have more out-of-pocket cost, or they will only pay 60%. But the good news is, the way these plans are all designed is they all are capped at a maximum expense to the insurance policyholders for a family of $12,700. I know that sounds like a lot, and I'm not going to go through all the details, but the main thing is they are going to pay the majority. These are all good plans regardless of which one you get, but the silver plan is the best bang for the buck. If you don't have the money and you're just trying to get something, go for the bronze plans. But whatever you do, in my humble opinion, which is highly accurate and thoroughly well researched, is don't buy a gold or platinum plan unless you just got way too much money and you want to get rid of it. You can do whatever you want, but that's my recommendation. So that's a cool tool. Just click on the goofy George Washington Chevrolet Monte Carlo looking dude on the dollar bill, and you can use that subsidy chart. Now, one of the things that we were really hoping would happen is that by now we would know what plans are going to be available in exchanges and all the cost and everything. But here in Texas, we've defaulted to the federally run plan, and based upon all the information we have, I'm not going to have access to any of this stuff until October the 1st. So until then, we have very little to go off what's available. I do have included here the plans that are going to be available in a sense of, you know, the metallic levels and how they cover, but this is all generic information. Again, the silver plan, in my opinion, is going to be the best ticket to get what you need. So until we have all the details, because here's what I'm going to do. If you'll scroll down the bottom of this page, I would recommend that you sign up for our how to apply for Obamacare video. What I'm going to do is, as soon as I can apply, whether that's October the 1st or the 2nd, I'm going to go through all the forms step by step, complete them myself, and purchase a plan. And then I'm going to tell you why I purchased that plan and what I think, why I do what I'm going to do, which I think will really fit for most people. So I'm going to record that. It'll be a webinar just like this, and then you can watch it. And so I don't recommend, anyway, sign up for this, and we'll continue to feed you information on the simplest, easy ways to get signed up with quick links where you can get it done quickly. I would recommend you stay away from calling any navigators or trying to get help from healthcare.gov. You're going to get confused. All the people that they have hired are just now in training. They're going to be confused. So just stick with us, and then as soon as we have the information, we will get it to you so you can get the health care you need in the simplest, easiest, most cost-effective and time-effective way to get that done. All right, well, I'm going to wrap this up, sign up, and we'll send you some information, and then once we get that video done, we will send that to you as well. If you have questions, please feel free to call me. My phone number is right here, 512-656-9378, or email me at greg@funnyhealthcare.com, and we will help you get this figured out. Have a great day, and we will talk to you soon.